50th anniversary. I have no financial disclosures. As you know, the ascending aorta is an area of challenging anatomy for the reasons listed here. It also has a high risk of complications, including stroke and retrograde type aortic dissection with endovascular repair. The ascending stent graft, or the ASG device, is specifically manufactured for this anatomical area. It has a broad diameter range from 34 to 53 millimeters, and it also has a specific deployment that's geared towards this anatomy, which is a staged deployment where the device goes into a intermediate diameter before going to the full diameter, and then there's active angulation control after deployment to adhere to the inner curvature of the aorta. The ARISE-1 was the early feasibility study, and this is a summary of that application. There were some patients who were enrolled for the actual trial, and there were also patients who were given this device as part of an FDA emergency and compassionate use authorization. All the patients who were enrolled in the trial had classic DeBakey 1 or 2 dissections. This is the update this year. 21 subjects were enrolled from 6 U.S. centers. The enrollment completed in 2021, and long-term follow-up goes through 5 years. 2 subjects have reached the 5-year follow-up time frame and completed the study, and another 5 subjects have reached a 4-year endpoint. This is a 30-day mortality rate of 15.8%, which is high but compares favorably to historical data for patients who are not operative candidates with type A dissection, which ranges from 50 to 66%. In the emergency and compassionate use arm, the 30-day mortality was 27%. The neurological deficits are the Achilles heel of ascending aortic repair. The incidence of type A all strokes was 30%. For severe stroke adjudicated by the CEC was 5%. Disabling stroke was 10%, and in the emergency and compassionate use arm, it was 5.3%. And again, this compares favorably to historical data, but again, it is the Achilles heel of ascending repair. This is an example of a patient enrolled in the ARISE-1 study, courtesy of Dr. Brinkman in Texas, which shows sealing of this type A aortic dissection. This is some of the follow-up data through 60 months for the patients who have reached those endpoints. This is a summary of the early feasibility study serious adverse device events. 5 patients reached this endpoint for a total of 23.8%. Some of these were injuries associated with the device in 1 patient. Endoleak was the most common, endpoint reached in 3 patients, and device placement issue in 1 patient. This is a summary of the treatments for the adverse events. The majority were medical therapy. 13 patients, 61.9% reached that endpoint, and the total for any adverse event treatment was reached in 18 patients for 86%. 3 patients had late mortality. 1 was unknown cause of death. Second one was aortic rupture related to the disease, and the third one was related to pneumonia. This is the ARISE-2 study, which intends to address diseases of the ascending aorta, including pseudoaneurysms, chronic and residual type A dissection, and other isolated lesions. There is a primary and the secondary arm. The primary arm intends to address just an ASG device. The secondary arm is a combination of the ASG device with the TBE, which is the thoracic branch endoprosthesis, plus or minus a C-tag. These are the enrollment goals. The primary arm hopes to enroll 70 patients with the ASG device alone, and the secondary arm from 50 to 150 patients with a combination of the ASG and the TBE device. The manufacturer also plans to do a follow-up for those patients who do not meet enrollment criteria as part of a surgical cohort. In summary, ladies and gentlemen, endovascular ascending repair is the last frontier. The first U.S. early feasibility study has been completed. The ARISE-2 pivotal trial is in progress, and we have to tailor this therapy to the patient risk profile, the anatomy, local expertise, and the available technology, and there are significant opportunities for improvement. I invite you to join Dr. Eric Rosselli's talk at noon for a further update on the ARISE-2 study. Thank you very much for your attention.